PDSA stands for Plan, Do, Study, Act, and it's a test of change. So we're planning a big reorganisation of stroke services in East Dorset a bit later on this year. So hopefully in October, all of acute stroke will go to Bournemouth Hospital and all of TIA patients will come here to Poole. So a TIA is a transient ischemic attack, so it's not a stroke. It used to be called a mini stroke. It's a warning that a stroke may be about to happen.
I think it's definitely the right way to move forwards. It's making sure that the patients are seen by the right people at the right time in the right place, and it's a timely and seamless service so that patients aren't stuck at any pathway.
And it also means that we can concentrate resources, we can improve the resource that we've got there to look after patients from medical, nursing and therapy input, so that hopefully patients will get better care and obviously better outcomes as a result of that.
So when that patient is needing that really hyper-acute care, when they're at their most vulnerable, they've got the right number of nurses here, and just having the right people all in the right place at the same time just means that they have the best care when they've had their stroke, and then they can carry on their rehabilitation wherever that is, as close to home as possible.
It's a benefit to the patients at Bournemouth, the patients at Poole, and from a staff point of view it means we can focus on doing one thing and doing it really well. So that enables us to spend the time really concentrating on the new patients as they come through.
The reason that the change is going to benefit patients is that we know from various other stroke services that if you have compliant hyperacute stroke unit care, you have an improvement in mortality and patients generally are less disabled and do better. So that's from the stroke side, but also from the TIA side. We know that how important it is to see, investigate and treat TIA patients within 24 hours of their symptoms.
There are huge benefits for those patients that need that specialist care. They are going to get that specialist care. They are going to have the best possible care in the best place. It may not be round the corner for them. They may have to travel a little bit further. Their families may have to travel somewhat further. But having that experience and that knowledge in one place means that they are going to make the best possible recoveries, and that's what it's all about.
I am one of the stroke consultants at the Royal Bournemouth Hospital, and during the PDSA we were able to share our resources in a more efficient way across both hospitals, focusing on strokes at Royal Bournemouth and TIAs at Poole. This meant I was able to spend my time in our emergency department attending to patients as they arrived, supporting our stroke outreach nurses in assessing the best treatment, including making thrombolysis calls.
Yeah, I definitely think that it will be more effective for the patients. I think it's great doing these practice days because it gives us a chance to work out what the problems will be and make sure that it all works well for the patients when it starts.
Both hospitals have good stroke services at present, but there is currently no capacity for stroke consultants to consistently attend ED at either hospital to help those needing urgent specialist assessment and treatment. There is also limited stroke consultant service at the weekends, so by realigning in this way, we will be able to ensure better cover for all our patients throughout the week.
Well, I think initially there was some anxiety around the PDSA, as I think that's quite natural to expect. There's always that worry that there would be a large influx of patients at the time, and would we have the beds, would we have the staffing, would we be able to manage? But giving us an opportunity to actually test the waters and try that has given the staff reassurance that actually with all the measures that we've put in place, that we've pre-planned, it is manageable, and we were able to sustain the flow and still maintain our high standards of patient care.
During the PDSA and when our services are joined with Poole Hospital, patients will come from further west to the Royal Bournemouth than they do at present. But research proves that by concentrating our resources in hyperacute stroke units in this way, it gives better consultant cover. Lives will be saved, patient outcomes enhanced, and it will improve the provision of evidence-based clinical interventions. Focusing on TIA patients at Poole will also improve outcomes, as they will be seen within the required timescale to ensure we reduce the risk of stroke.
I think we've got a really good team here, and I think that if anyone can do it, we can.